And I will go ahead and share my screen. Welcome. Today is November 5th, 2025. And we are talking about program evaluations today. And share screen. All right, can you see that?
Yes.
Thank you. All right, that's what I just said. We're talking about program evaluation. Okay, so what is evaluation in the context of a grant? And it's really intended to answer the question, is what you're doing, so think about that activities column in the logic model, are those activities getting you closer to the goal that you're trying to achieve with your project? And how do you know? So that's what the evaluation is intended to answer. And the questions that you're trying to answer to figure out if you're getting closer to that goal should be your outcomes. What are you measuring to figure out if you are getting closer to that goal? And then from a funder perspective, of course, it's generally not free money. They're just handing out, as that would be a donation. With grants, there is an expectation that there is accountability and communication around that. So they're really making an investment and they want to know that they're making a good investment. And especially if you think about ongoing funding, like year after year, you want to make sure that you are showing that you are a good investment to make. Program evaluation is not to be confused with research, and I added this little blurb here from one of our funders, the Office of Juvenile Justice and Delinquency Prevention, which is a federal department under the Department of Justice. And they make it a distinction here about project evaluations are really only to generate data or information for internal improvements and to meet the expectations of the funder. They're not meant to be generalizable to the population at large. It's more contained, concise, does not have the regulations, stipulations, expectations that usually come along with research, like control groups or some, advanced statistical analyses. When we use an external evaluator, we do have more information, and sometimes we do see some of those more advanced, like statistical analyses occasionally. Um, but the intent continues to be improvement of the program or service, making sure we're doing what we said that we were going to do. It's not about trying to publish something or trying to get evidence for a model that's effective. It's really more of an internal process. There are two types of evaluations that are common in grants, and one is a process evaluation, and the other is really the outcomes. So, process is comparing what actually happened, looking backwards, kind of retrospective, compared to your application and what you thought would happen. So, usually we'll have a timeline, and we would look back and say, we did or did not hit our timeline or hit our outcomes because X, Y, and Z. For example, it took longer to hire staff than expected. And so process evaluation includes both successes, this is went well, this is what went well, and then lessons learned, what we would do differently next time. Outcome evaluation is might be more what you're thinking about in terms of a common definition of evaluation. It's like it's the numbers. Did you hit whatever you expect it to be. Um, Whatever that outcome is, and we're going to talk more about this. Um, we at LUK set a target, so it'll be like 75% of program participants will do something, or 85% or 90%, whatever that percentage is that makes sense. And that's something that we decide in the process of program development. Um, and then you look at your data to determine whether you hit that or not. And then the process evaluation can explain why or why not. Does that make sense? Process evaluations are not um, a common, like definitely not as a standalone. Sometimes they're a piece of a report that we have to do back to a funder. It's usually in terms of lessons learned. All right. Some funders use the word objective, which is usually interchangeable with outcomes. What I put this in here not to confuse folks, but objectives, you might be familiar with the SMART objectives or SMART goals. Well, there's a newer version that is Smarty with an I and an E. And this is helpful kind of to check and see whether your outcomes have all the pieces and parts that are necessary. So this would be like gold standard. The S stands for specific. Does the objective state an outcome that you aim to accomplish? What population, by when, how much? M is for measurable. How will you track your progress? And know when milestones have been reached and objectives achieved. The A is for attainable. Is the objective challenging but achievable within the context of the program? And do you have enough resources? So remember that resources would be reflecting back to the resource column or input column in the logic model to make sure it all makes sense. And then R would be, is it relevant? Are you planning on measuring something that makes sense in terms of the context of the program? One of the things we used to do a lot before we got more sophisticated was think about satisfaction. Are clients satisfied? And people could love a program, but not improve or not move toward the goal of the program. So that's less relevant than some of the other outcomes we could use. And so we don't use that one much anymore. T is time-based. So sometimes our outcomes will say by discharge, clients will X, Y, and Z. For some of our CES programs that are prevention, it will have like within a year or by the end of 12 months, we will see this improvement in a reduction in substance use, for example, on the YRBS, the Youth Risk Behavior Survey. And then I and E are the two new ones. So inclusive and equitable. And you can see this did come from the CDC. It is still available online. Ideally, we would want to be paying attention to our objectives and outcomes being inclusive and equitable as well. I want to
Um,
pause. Yeah, Anthony,
I was gonna say,
can you say your question out loud?
oh, sorry.
Mhm.
Yeah, it was just in response to Phoebe's note that this was being
Okay.
recorded. It's not relevant to this moment. I was just asking if the previous few meetings were also available. The recordings are available, particularly the budget one
Mhm.
that I'd hoped to make but wasn't able to.
Yeah, yeah. So if you go on luck.org/NPDI, there should be a link there.
Great.
Otherwise, you should also be able to log into Talent LMS if you have a Luck staff login. And Jen has also put them all on Talent LMS as well.
Oh, great.
And if you can't figure out either way, just let us know and
Okay, thank
we'll
you.
hook you up with that. Yeah. All right, cool. So just to come back to the slide, so it's good to keep these aspects in mind as you're thinking about your outcomes. But I'm going to show you the pattern that we typically use at LUK, which hits most of these, not all the time. Oops. Forward. Ooh, okay. Let's go to Menti now, and hopefully we can have a little bit of fun. And let me stop sharing real quick because I need to share my screen differently. Okay, here we go. So if you're watching the recording, you probably cannot do this, but you can watch us do this. All right, is everybody there? Everybody ready? That's thumbs up, some nods. Awesome. And go to the next slide. Okay. What words come to mind when you think of evaluation within the context of LUK's programs and services? Ups and downs. And you can add more than one. QA, yep. Goals, quality, teamwork. Numbers, yes. Oh, demographics, yep. Documentation, surveys, change, targets. Yep, we use that a lot. We talk about targets. What's our target? Both in terms of outputs, so that's like number to be served, things you can count, as well as targets in terms of our outcomes. That's you'll see as I show you more slides, whether their target is 75% improve or change in some way, or 85% or something like that. We do think of that as a target. All right, let me go to the next slide. Oh, pop quiz. Which of the following are indicators that we use in LUK evaluations? And oh, this says you can pick up to 3. All right. These actually are all indicators that we use. And I will share some of those with you when we get back to the slides. All right, here's one. So think of LUK mentoring. So mentoring pairs an adult who's been screened and trained to meet with a youth for an hour a week for a year. What would you suggest would be some measures, some things that we should use to evaluate the mentoring program? Matched pairs. Yep. So that's the adult matched with the youth. Yeah, so for the second one, um, what are those goals or outcomes? Like, if mentoring was your program, what would you recommend? Ah, funder requirements. Haha, yes. Oh, self-esteem, yes. That could change. Yep, maybe making progress towards some goals. Satisfaction. Oh, social media outreach. That is an indicator. Yeah. All right, thank you. I think we might have one more. Where do we get our data from to evaluate our programs, to evaluate LUK's programs? Demographics, surveys, care logic. Yep. Oh, my answer's too long. Success stories. Here we go. Staff, client surveys, pre and post tests, interviews. Yeah. Awesome. We will be talking about all of these options and more. I think that is the end of our presentation. Bear with me while I get our slides back. Okay. Okay, so we just did the Menti. Thank you so much. So here are some examples. So we don't have anyone from QA here with us today. These next few slides are actually from one of our quality improvement plan reports from a couple years ago. So what is covered up here is client outcomes, individual action plan, and this is looking at different divisions and the percent of clients who have discharged, who have made progress. Now, there's lots of variables that go into whether how progress is measured and how that's defined, so don't get too hung up with what's on here. These are just examples. So another outcome, level of care. Is it at the same? Are they discharged to the same level of care, or higher or lower level of care? More restrictive, less restrictive. Okay. Discharge according to service plan. That's what this is. And again, lots of variables go into this. You know, how good is the documentation, as well as what does this mean, the service plan, discharge according to service plan, because the service plan can change. Um, so we're not here to try to interpret this. These are just examples. And then I pulled some directly from logic models that we have. So CCBHC is Certified Community Behavioral Health Clinic. Okay, it's funded by SAMHSA, so a federal department. And our goal is to increase access to and availability of high quality services that are responsive to the needs of the community, support recovery from mental health and substance use disorder challenges by comprehensive community-based mental and substance use disorder treatment and support. So that's a mouthful. We have 3 outcomes here that we have proposed to measure to determine whether we're getting closer to that goal. And you can see we have targets of 85% or 50%. And think back to the SMART objectives or SMARTY objectives. So we have our target we have the population of clients involved with CCBHC, so being specific. And then what are we actually expecting? We're expecting an improvement in well-being. And then as measured by, this is really key to have that as measured by in your outcome so that you know that there's a plan in place and that you're ready to go with a measurement. And they have two options here of goals depending on the client, I believe, whether it's mental health or substance use, or they could have both. And then second outcome, 85% will experience an improvement in identified social determinants of health. That's what that is. So like basic needs as measured by the goal. And this was left blank because it was still in draft form. So what we would usually do, and this is usually with Shayna out of QA, is meeting with Shayna and usually Kelsey too, looking at the goals that are in CareLogic and finding the ones that match best. And then at certain increments, we'll look at how we have actually done and compare it to, did we hit the 85% or not? And if not, then we'd usually do some kind of a redo process in order to get that up. And then this also had an infrastructure outcome because of the expectations of the funder. And this, you could think about this as a measure of quality and also potentially as a process outcome. Are our systems and structures set up so that people can get their first appointment within a week? And then we have how we are going to measure that. And CareLogic, it's always nice to say like where the data is coming from, whether that's CareLogic or the activity database or surveys in SurveyMonkey. It's just nice to have these to be as complete as possible. So here's another example, PIFAS. This is a CST program now. It's one of our DCF support and stabilization programs, and it stands for Promoting Youth and Family Solutions. And the goal of this program, keep kids safe at home. And how will we know if we're doing that? Our first outcome is to increase the community languages. Specifically, we want to measure whether at least 50% have increased their community languages. And we're saying how that's going to be measured. There's a standard goal in CareLogic for the individual action plan. The second outcome here is strengthen family relationships and communication skills, again, as measured by the standard goal in the IAP. And you can see here, this LUK standard is 2 core program outcomes. And then there's sometimes more. So that's why this also has a secondary program outcome, which is not necessary, but you'll see as we go through the slides, some funders have a lot of outcomes they're expecting us to pay attention to. And if you were here or watched Shayna's presentation on the logic model, she talked about the second page of the logic model, kind of just as a reminder that the funder is looking for more than just LUK standards. And here's one, mental health promotion and suicide prevention training. And our goal is to increase the number of people who can recognize signs and symptoms of mental illness and know how to appropriately and safely respond and access resources. And you can see our outcomes here, 85% of trainees, so that's our population, the people who are participating in the trainings, increase awareness or knowledge. And you can also see as measured by LUK's training and workshop evaluation, which is in SurveyMonkey. So sometimes we'll add that as well. Here's an example. I'll I'll come back to you, Steph, in just a second. I just want to show you an example of this is just a piece of what this funder is looking for in terms of outcomes. And they have um, multiple pages and instructions. And if we have time, we can go back and look at this. But they're measuring all kinds of things from it having to do with delinquency prevention. So whether youth are detained, adjudicated, if they violate a court order, elsewhere, I didn't add them all, but if they're victimized, if they're re-victimized, and then more things like self-esteem and making better choices and less risky behaviors. So, Steph, go ahead. What was your question?
Actually, it's not a question. You were just
Oh,
doing the
yep.
suicide,
Hmm.
those goals.
Yep.
Actually, we just trained, well, I trained 55 staff members
Hmm.
from Fitchburg Public Schools yesterday.
Oh, nice.
So we had like three different groups, but it was a nice chunk. But it just reminded me when you were
Hmm.
talking about that percentage, we're really hitting numbers right now with that training. So
That's awesome.
that was
Really
all.
good. Ah, no, thanks for sharing that. I always love when things come like full circle. So there's OJJDP has huge expectations. As I mentioned, on Lux Logic models, and Shana shared a few weeks ago, two core program outcomes with a target percent and then as measured by. So just reminders as you're working on your logic model as well as your evaluation plan. Okay, so this was in the Menti. So what are some tools that we actually use? So we might use standardized surveys. So for our youth substance use prevention work, we use questions from the Youth Risk YRBS behavior survey. Um, and that's standardized, administered across the country, really. And you can find data for the different states on the CDC's website. But we also have some surveys we've created on our own. So usually we have taken, if we use pieces of, say, a couple different evidence-based practices, and those practices have their own evaluation tools, we might pick a couple questions from each one. Or I think our training survey, think of any trainings that you do. There's usually questions on the end trying to measure what you have learned. And sometimes, like, what's your intent to use this information? How might you do things differently in the future? Sometimes there is both a pre-test to measure like the baseline, and then you do your intervention, and then you do a post-test. Sometimes there's just a post-test. It depends on the model, the setting, the population, so forth. Other things that we use, the IAP goals, which we saw in the earlier slides, discharge according to service plan. We will probably begin seeing global wellness survey results, as this is something that LUK has started to implement. Interviews, we've had some evaluators do interviews with our clients. And I think that for SPARS, that also used to be a guided interview that we would then um, enter the data into the system. And some of the systems that we do use, so CareLogic for client data, participant data, LUK activity database, whenever there's like trainings or groups. SurveyMonkey is the tool we use for surveys, which we do have folks, if you're thinking about doing a survey, there are people who have access to the accounts who will actually set up the survey for you. But individually, you have to come up with the questions. Excel is pretty common to use to look at your data. REDCap is a system used by some of our funders, RHY, HMIS. That's runaway and homeless youth. I'm not quite sure what HMIS stands for, homeless management information system, perhaps. That's used by some of our federal funders as well. What? Thinking back to the beginning, whenever I talked about like funders and funders wanting a return on their investment, we let them know we communicate with the funders through reports. And here's one example of how we summarize all the pieces of data that are coming from lots of different places. And we have help from our friends in QA and MIS to get these data. But you just summarize. You have the number, and then hopefully somewhere you have the target as well. So you can point to it's more than, like you went beyond your target. You have your population, youth who are matched at least 3 months. And then what happened? They improved with their connections, their lifelong connections. 100% improved self-esteem, 86% increased involvement in healthy recreational activities. So those really nicely, like cleanly, clearly summarizes the impact of the service or program that we provided. And just in the context of NPDI, there are quarterly reports, but they really are meant to be low stress. And they're not always a written document. It's like coming back to this group and just sharing how things have been going, for example. I think that is the end. So let me stop sharing and see if we have any questions. That went a lot faster than I thought it would. No problem. And Phoebe from program development has shared about YRBS data. Also really helpful for your needs section. Any questions? Well, if not, then that is our overview of evaluations. If folks have questions, feel free to reach out to us. Also, feel free to reach out to Shayna or QA. And I see you, Melanie, with your kitty. trying to sway me in some way.
He's a menace.
Yeah. But I think then we're all set for today. So thank you for being here. And if you, again, are trying to find the recordings, any past recordings, and you can't, just let us know and we'll point you in the right direction. Yep.
Thank you.
Awesome. Thank you. Have a great day.